Hello, everybody. Tonight we're going to talk about locator troubleshooting. We're going to call this series Locator Case du Jour. The goal here is to try to present clinical vignettes that best help us understand how to use a locator system. I don't think it's a secret within the industry that learning how to use locators really well is not as easy as it could be. The information's out there, it's just sometimes hard to find. So we're going to start with this case. This was sent by one of the doctors. And the question was, how do I replace this? So this was his first locator case. He hadn't done any in dental school. And the patient was losing a lot of the retention from this locator due to the nitride coating here had worn away. As you can see, this is normally gold, but it's worn through as the retentive nylon sleeves have worn away the metal on the locator. So in general, this tends to happen somewhere on the order of several years to maybe 10 years. Lots of factors indicate how long these last. Bruxism, the height of the locator abutment itself, how often they're switched out, how well they were picked up, a whole host of factors. But in general, when new locator nylon sleeves don't do the job and you see this worn appearance, it's time to switch out the locator, which the doctor knew was the right call. But this was not an implant he had placed. So how do you go about this? Implant manufacturers, Zest is the company that makes the locator abutment, manufactures the locator abutment for most, if not all, implant manufacturers. So the first thing you need to do is you need to know, I'm going to create a little checklist here, you need to know the implant manufacturer. The second thing you need to know, maybe, sometimes, is the abutment manufacturer. Now, if you're going to replace it, it's not that important that you know what the original abutment was. Yes, locator is the most common, but it's not the only one that's out there, especially today. There's lots of other companies making abutments that look similar and function similar to the original locator abutment. So it may be necessary to know this. This might be hard to find, depending upon the age of the patient, where they lived, whether the original dentist had kept their records or not. But that might be information you need to find. The tissue height, we're going to go over how to measure that, is another important part of understanding what parts to order when replacing a locator abutment. And then also tissue width. So the first thing he did, he found the implant manufacturer that had made the implant that this locator was sitting on. This was a Camlog implant. Reading this and understanding how to order the right locator abutment based upon what you see here is an art in and of itself. In general, calling the company and just asking for technical assistance will get you the help that you need. I'm not going to dive into the Camlog implant. I just wanted to share what he had used for information, and we'll see how he arrived at the proper locator abutment that he's going to need to solve this case for this patient. Before we go on, we don't always have access to this. So what are some methods that we can use to try to identify implants? I would say the most common or the longest standing method that I think most dentists use is whatimplantistat.com. I think this is a great website. It's not as user-friendly for the implant novice as one might think. So unless it's Straumann or Nobel, I think it's hard to find the right implant with this. I think it's a great tool in the absence of anything else. It has saved the day for me many times. With that said, I think there's something better out there, and that's this company called Preat, P-R-E-A-T. And if you go to their website, they actually have an implant identification program where their technicians will use their experience to help you figure out what the implant might be. You can also order parts from them, drivers, all kinds of things. So Preat is a great company that fills the hole whenever there's a question with prosthetics. They're a great company that can help solve that problem. But let's move on. We know what the implant is. It's a cam log implant. So the next thing we need to know is the gingival height. So there's two ways of doing this. The first is just using a perio probe and measuring from the head of the implant to the tallest aspect of the collar of the tissue. The shortest is irrelevant. It's the tallest. It's that height that we need to know so that we order the right locator attachment. There's a whole conversation about what to do if there is asymmetrical tissue here. Do you need to do grafting? Do you need to do a gingivectomy? In general, I think most clinicians just measure the highest aspect of the tissue and go from there. So when you know that, you can order the right locator abutment. This is an example of a locator here. The cuff height is essentially the zone, the transmucosal zone, that connects the platform of the implant to the zone that's going to act as the female component so that the male nylon sleeves can attach on them. This distance here is not really that relevant. I wouldn't worry about that. It actually varies quite a bit from anywhere from 1.5 to 1.7, 1.8, depending on the manufacturer. But in general, knowing the cuff height and ordering the right locator abutment for the implant manufacturer are the two most important parts of this whole sequence. But there are times when taking this off is not necessarily an option. So why not use a radiograph? Radiographs can be helpful, but they can also be misleading. To the novice clinician that looks at this, what are they measuring? What in this image here is going to give us information on what the next locator abutment should be. So I'm going to kind of walk through what I had recommended this doctor to do. Again, coming back, there's not a whole lot of information here for the doctor to say, I need to order a locator abutment of XYZ dimensions. So here was the image that he had sent. For those who have never seen locators, this is the male housing that sits in the denture. So this image was taken with the denture in place, which is fine. This is the locator, and then here's the implant. But we really can't see with a whole degree of clarity where the interface between the locator and the implant is. Part of this is just the angle at which this image was taken. If it was taken in a more bite wing manner, we probably would see the junction a little more clearly. But if we zoom in, this was the original image he had sent me. The first one I showed you was more of a kind of a zoom in from this. But you can see, it's rather subtle, but you can see the interface between the implant and the abutment. I'm familiar with camlog implants, so I know what they look like. It has this this smooth collar right here. A trained eye can see this now, but looking back here, rather hard to see. So you might have to take a couple images in order to see the junction between the two. If it's perfectly if the X-ray beam is perfectly perpendicular to the implant interface to the abutment, you typically can see it. The other aspect of this image that was important was the gingival height. All right, so this image, again, it was a lot more clear to the clinician. We had determined that this was the gingival zenith in relation to the collar, the collar of the implant, which is the interface between the abutment and the implant. It's this zone right here that we need to measure. So what he did is he measured here, it was 3 millimeters. If we go back to this image here, we can see that there's quite a bit of locator exposed. And a good rule of thumb or a good standard protocol to follow, you want the shortest locator abutment that does the job. That is why it's important to measure the cuff height when you're putting the locators in. It's not uncommon that a doctor will have 4 millimeter locator abutments for an implant system that they use. Patient shows up, they didn't do the tissue measurement, and the transmucosal distance was 2 millimeters, but they just used their 4 millimeter locators. That, unfortunately, doesn't result in a very favorable biomechanical situation. Moral of the story is you want to measure the cuff height, which is what we did here. So the doctor went, and I don't know where he got this, but this is accurate. He was trying to find out what the order number was for this locator for the Camlog implant system. Of note, Locator RTX, this is a different system. This is not the system that most people are familiar with. I don't have any experience with this. It's been around for several years. It was kind of a popular thing when it first came out. I haven't heard or seen much of it ever since. With that said, when you see RTX, do know that this is a separate system, separate abutments, separate prosthetic components. Locator by itself is the traditional system. So this is the locator abutment here. And then as you can see, there's a whole bunch of options, and I'll zoom in on that. Camlog implant. Camlog is a company. You should know that many companies have several lines, so you should know exactly whether or not the prosthetic interface of that company is in line with the specific series or the specific model that that implant company has. I think in this case, Camlog has only one prosthetic interface, which is similar with many other implant companies, such as BioHorizon. They try to simplify it by not having separate prosthetic components for their different implant systems. So here, he has all of these options to choose from. So how does he know what to choose? Well, let's just take a look at this chart. This is the diameter of the locator, and this is GH for gingival height. So knowing which of these to choose really depends upon understanding what we're looking at. Coming back here, we've determined that the gingival height through the use of this x-ray is 3 millimeters. We also can see that this particular locator's width is a standard width, and we're going to look at that in a little bit. What is standard? So we'll come back to that. So what we're trying to do is find out what order number to order here. All right. So here we have measuring the cuff height, but in addition to the cuff height, there's also collar width. And just to show some contrast here, see the width here is wider than the width here. This is a standard width. It's 3.86 millimeters. If you look at the locator website, that's the width here. I would say 90% of locators are chosen with this particular dimension. I can't say whether or not this is inferior or superior to something like this, but what I can say is if the patient already has a locator, you should probably know what the cuff height is so that you don't end up leaving a gap or end up compressing the tissue too much by having the wrong diameter. So if we go back to the image again, we know that this is the same width as the locator. We'll call this the hub at the top. So if we come over here, again, this comes from their website. This just looks the same. We know this is 3.86. So if that's true, then we know he needs to choose the 3.8 diameter. So we've narrowed it down to one of these. Keep in mind that the 3.3, this body here is actually more narrow than the female component of the locator abutment. And then this one here, the 4.3, looks something like this, and then they have even wider. I haven't played around with these in general. Whenever I place an implant, I place a 4 millimeter wide healing cap of whatever height I need, and when the healing period is done, I take out we use BioHorizon, we take out the BioHorizon healing cap of 4 millimeters, and the 3.86 fits really well right into that space without a whole lot of issue. So again, the cuff heights vary. Coming back to this here, we had determined 3 millimeters. So this is the order number that he needs in order to solve this patient's problem. So that's the workflow or the thought process behind trying to figure out exactly which implant system, which cuff height, and which cuff width you would need to replace an older locator abutment. Just to bring up some other images I found online, you can see here that the cuff heights change as the transmucosal section here gets taller and taller. I would say most of them are going to land somewhere between 2 and 3 millimeters. Every once in a while you'll get 4, 5 millimeters exist, but it's somewhat uncommon, and I think some implant manufacturers even have 6 and maybe 7. The rotational force or the moment force or the biomechanics do become more concerning the taller you get, so you don't want to use this tall situation when you have this kind of tissue situation. In addition, if you use a tall locator abutment, when you don't have all this tissue, you end up having a very significant, this will be hard to say, inside the denture itself, the housing is very far away from the tissue, so you end up having this tall channel of acrylic, and it's very difficult to change the locator attachments. It's just an unfavorable situation. So in general, always follow the tissue heights when ordering your locator abutments. Lastly, I put this on here. If you dabble in this world, I would understand what all of these are. I would understand the use of the blockout spacer, the denture housing, the male processing cap, and how you need to replace that after you've picked everything up. This is called the locator core tool. It used to be called a 5-in-1 tool because it does 5 different things. I would know what those 5 different things are, what the abutment sleeve holder is. If you don't understand all of these, then you might not be executing the care at the level that your patients deserve. Also understanding the difference between these 3 and these 4. I'll just leave it at that. These are extended range locator male nylons, and these are conventional nylons. So that's pretty much it. We'll end there. We'll continue to do cases like this with locators to try to expand our knowledge in the world of overdentures, 2 to 4 implant overdentures. We'll dive into bar overdentures eventually, but hopefully this helps, and I look forward to providing more cases soon. Take care.